Hey everyone, and welcome to our monthly member spotlight series. Get ready to meet the amazing people that make our society shine. Each month, we'll take you on a journey into the life of a different SIO member, highlighting their unique story, celebrating their accomplishments, and exploring what drives them. To begin, I am Tabarak Qassim. I am a resident doctor at Cambridge University Hospitals in the UK. Today, we've got with us Angela Lorbeck. Angela, would you please introduce yourself?
Yes, hi. It's so great to be with you today. My name is Dr. Angela Lorbeck. I have been with Rush University Medical Center for 22 years. For the past 18 years, specializing in integrative oncology. And I started the acupuncture program back in 2007, and then in 2021, collaborated with Pacific College of Health and Science to create an oncology specific training program for master and doctoral level students. And in addition to my work at Rush, I also just recently launched in the last year an educational consulting, wellness consulting practice where I'm bringing resilience as well as integrative oncology education and training into various places, corporations and community settings and things like that. So yes, a pleasure
Perfect.
to be here.
Lovely to meet you, Angela. So,
Thank you.
Angela, I'd like to know what is your drive behind getting involved in integrative oncology and the mission you are intending to serve?
I love this question because, I long before I even knew about cancer or could even, knew about oncology, I really knew what it meant and how important it was to care for other people. When I was 9 years old, my parents were going through a pretty bad divorce. And the courts we ended up having joint custody of us kids. And as the oldest of three, I cared for my young twin siblings while my mom worked three jobs in order to make ends meet. And one bright shining spot during that time in my life was my nana and papa bought me a pink and white checkered Schwinn bike, and I filled that bike one day with band-aids and cotton balls and ace bandages, and I started to ride around my community to try to find people who were hurt. So my passion and interest in wanting to help people, I guess, started at a really young age. And that kind of just stayed with me. And as I went throughout my educational programs, I started to learn about the field of, the mind-body connection, which then eventually led me to studying acupuncture. And then in 2002, I joined Rush University Medical Center. And I feel like just this path unfolded in the most beautiful and perfect way. Um, for me to then get into the field and started working with oncology. In oncology, actually helped to start the acupuncture program back in 2007, and it's been my life's passion. And truly, I feel like my life's calling ever since.
I could hear the passion in your voice, and I'm certain you've been so successful in accomplishing this mission. So, Angela,
Oh.
I'd like to know about the impact you've had on others. Would you like to share with us a story that has impacted you about a patient that you've helped using integrative oncology therapies?
Yeah, there have been in my 18 years, I've had the extreme privilege and honor of working with thousands and thousands of patients as young as 5 and up to probably my most wisest patient at the age of probably 96 or so. And so there have been so many over the last years. But given that September is Childhood Cancer Awareness Month, I thought that I was thinking back to when I had received a grant it was a feasibility acceptability study to explore the role of acupuncture in pain management and quality of life in pediatric patients. And I'll never forget, probably one of my youngest patients for that study was enrolled and this individual was going to be seeing me as the other participants were once a week for a series of 8 weeks, and he had never had acupuncture before. And as a little one with osteosarcoma, similar to adults sometimes, right? He was very afraid of the needles, and so one of my goals, of course, was to do whatever I could from the very beginning to gain his trust.
Mm.
And so his mom was in the room, and so she was a calm and compassionate presence in the room. But one of the things, and I don't know why I thought to do this, but the needles that the type of needles or the brand of needles that I use have different colored tips on them. And I had learned from my intake that he really likes art, and he I guess he has a really colorful room at home. And so I said to him, and this is not his name. I said, Trevor, I said, look at the different colors of these little healing sticks. We call them healing sticks. And I said, which color do you think that you like the most? And he's like, I like the blue ones. I said, that's great. And I said, okay. And he talked about love for family. I mean, this kid just was so wise and so like had so much love inside of him. Yet while he was going through, the battle, the just this very, unfortunate experience with cancer. But anyway, and so I said, would you like to name, I mean, every single needle after someone in your family, and thank them for being with us today, and thank them for helping you heal? And he's like, yeah. And so before I would insert a needle, he would say, thank you, Aunt Beth, for helping my knee heal. And then we would say, thank you, Uncle Joe. I mean, it was so beautiful. I will never forget that young boy. And you know what? I guess that experience really, and this kind of has not kind of, it is this, that experience has kind of is woven into the idea of that, has woven into every single kind of patient that I have. I love involving my patients in the treatment itself, whether it is um you know, whether it is involving them with like a gentle breathing technique, or collectively we set an intention for the treatment. I think patients really appreciate the opportunity to be involved. And I think that's one of the most beautiful things about this field is that we aren't doing things to patients. They're involved and they are active participants in their care, which this is one of the reasons why I love the work that we all do.
Absolutely. This is such an incredibly moving story. And
Aw,
if only he knew the phenomenal effect he's had on you, I'm pretty sure he'd be so
yes,
proud.
yes, yes,
Per-
yes.
Perfect.
Grateful for him and his experience. Yeah.
Absolutely. Could you talk to us about who has helped shape your journey, who has influenced your integrative oncology work, and how did they influence it?
Yeah. So, you know, so I when you sent me these questions, I immediately, without a second thought, it's it isn't one person. It has been every single patient
Mm.
that has been the biggest influence in my life as a practitioner. They have been my greatest teachers. And because when you're in school, you learn the foundations, and you learn the history, and you learn the anatomy and the physiology and the acupuncture points and the protocols and the all the stuff, and that's great and that's wonderful and that's needed and necessary. However, it is the patients that, in their stories and their hopes for healing, that really influence and have influenced how I am as a provider. The resilience that all of my patients have exuded, their spirit, their interest in wanting to, again, to be active participants in their care, have really taught me what truly matters in care. And while the treatment, of course, right, acupuncture is an evidence-based treatment that we know helps patients from a variety of perspectives. But what I feel like I've learned is that what also really matters in their care is having a compassionate presence,
Hmm.
making sure that you are fully present when you are in the room, because that matters. That patient practitioner relationship matters to people's healing. And so they have inspired me to grow as a provider. And now, ever since I launched the acupuncture oncology training program with my interns, that that patient-centered care, that compassionate presence, is a huge part of what I am now sharing and demonstrating and teaching my interns, because I feel like that is it's absolutely necessary in medicine. So my patients have been my biggest influence, and to all of them in the past and all of them to come, I thank them from the bottom of my heart.
I'm pretty sure they're so thankful to have you as their acupuncturist. It's
Oh,
very obvious and clear how much of an instrumental effect they've had on you.
oh, yeah.
Now, looking ahead, what excites you the most about this field? Where do you see IO and oncology care evolving over the next 10 years?
Yeah. So I mean, this organization is it's so exciting to be a part of this organization. It is so inspiring what people around the world are doing as part of this organization, from research and education and training. I just feel like, and then of course how we're collaborating with other organizations, and just this ripple effect. This ripple effect is currently and will continue to change the trajectory of cancer care. And I just feel like the future is so bright and it's so powerful and positive. And it is my hope, and this is one of the things that I shared recently in my TED Talk. It is my hope that every single oncologist, you know what I mean, feels confident and comfortable being able to, broach these topics during clinical encounters. That patients feel comfortable and confident, empowered to talk about their needs. And that people are referred, you know what I mean, right from the point of diagnosis, or at least educated about these powerful and evidence-based therapies, um, and and that integrative oncology is part of care everywhere. It's so important and so powerful.
I absolutely agree with you. It does sound like we all see a future where IO is fully integrated with conventional oncology and not as an add-on, but rather part of
Yeah.
a vital patient care. Thank you so much. Sorry, did you want to add
And
something?
yes, and one more thing. The other thing that is in if I could wave a magic wand, I mean, we need more people trained in this area, right? We need more acupuncturists trained in this area. I mean, all providers, you know, there needs to be more people available for patients to go to receive safe and compassionate centered care. So that's the other part of this. So thank you.
Thank you so much for this very last message. Angela, genuinely, thank you so much. I could feel your energy flying
Aw.
all the way from Canada to the UK. I could feel it. I could feel your passion. I could feel the ambition you have. Thank you so
Aw.
much. And we're so grateful for you. Truly a pleasure speaking with you today. To our viewers, thank you for listening in today. We hope you've enjoyed this month's feature on integrative oncology. We look forward to seeing you next month as we shine a light on one of our other amazing members of SIO. Thank you so much.
Thank you so much.